Pain is a major health concern affecting millions worldwide. It can be classified as nociceptive, neuropathic, or mixed, depending on its origin and characteristics. Neuropathic pain in particular arises from damage or disease affecting the somatosensory system. Many people experience chronic pain with neuropathic features, often described as burning, tingling, or electric shock sensation. Localized neuropathic pain refers to pain that is confined to a specific circumscribed area of the body. Recognizing these types of pain is crucial for selecting the most effective treatment strategies, especially as chronic pain can severely impact daily life and well-being. For many patients with localized pain, especially those with superficial pain generators like postherpetic neuralgia or musculoskeletal injuries, topical treatments offer significant advantages. Unlike systemic medications, topical therapies such as 5% lidocaine medicated plasters act directly at the site of pain, reducing the risk of systemic side effects, drug interactions, and overdose. This approach is particularly helpful for patients managed by primary care physicians who may not specialize in pain management. By targeting the pain locally, these treatments can provide effective relief while minimizing complications, making them a valuable option in modern pain therapy. Real-world observational study was conducted across 10 Italian centers specializing in pain management. The study enrolled 503 adult patients suffering from various localized pain conditions, including neuropathic and musculoskeletal pain. Each patient received 5% lidocaine medicated plasters and was evaluated at 3 key time points: baseline, 30 days, and 60 days after starting treatment. The primary goal was to determine how many patients experienced at least a 30% reduction in pain intensity by the end of the study. Secondary outcomes included changes in pain area, quality of sleep, and the need for additional pain medications. Study included a diverse group of patients, with an average age of nearly 68 years and a range from 17 to 93. Women made up about 63% of the participants. The most common pain conditions were postherpetic neuralgia, post-traumatic or surgical neuralgia, and musculoskeletal pain, but other types such as cancer pain and diabetic neuropathy were also represented. Pain sites varied widely, with the chest, lower limbs, and craniofacial areas being most frequently affected. Most patients had been living with pain for 6 to 24 months, highlighting the chronic nature of their conditions. For just 30 days of treatment with 5% lidocaine plasters, 72% of all patients reported at least a 30% reduction in pain intensity. This rapid improvement was seen across different pain subgroups, including those with postherpetic neuralgia and musculoskeletal pain. Not only did pain intensity decrease, but patients also experienced smaller painful areas, better sleep quality, and fewer symptoms of dynamic mechanical allodynia. These early results suggest that topical lidocaine can provide meaningful relief within the first month of use for many individuals struggling with localized pain. Continued use of the 5% lidocaine plasters led to even greater improvements by day 60. An impressive 90% of patients achieved at least a 30% reduction in pain, and similar positive trends were observed in all subgroups. The mean pain intensity dropped by up to 60%, and the area of pain continued to shrink. More patients reported better sleep and fewer required additional pain medication. These findings highlight the importance of consistent, ongoing treatment for consolidating and maximizing pain relief in localized neuropathic and musculoskeletal pain. Safety is a key concern with any pain treatment. In the study, 5% lidocaine plasters were generally well tolerated. Only 5% of patients experienced adverse events, most commonly mild issues like sleepiness, burning, or itching. Serious reactions were rare, and only 2 patients discontinued due to skin rash. Importantly, the need for additional pain medications decreased over time, suggesting that the plaster alone was sufficient for many. These results support the use of topical lidocaine as a safe option for long-term management of localized pain. Lidocaine is a local anesthetic that blocks voltage-gated sodium channels, particularly Nav1.7 and Nav1.8, which are involved in transmitting pain signals. By targeting these channels in damaged or inflamed nerves, lidocaine reduces abnormal nerve activity and relieves pain. Recent research suggests lidocaine may also have anti-inflammatory effects, such as modulating immune cells and reducing inflammatory mediators. This dual action makes it effective not only for neuropathic pain but also for mixed pain conditions with both neuropathic and inflammatory components. This real-world study confirms that 5% lidocaine medicated plasters are both effective and safe for treating localized neuropathic and musculoskeletal pain. Patients experienced significant reductions in pain intensity, improved sleep, and a decreased need for additional medications. The benefits were seen across various pain types and maintained over 2 months of treatment. While these findings are promising, further research is needed to compare lidocaine plasters with other treatments and to explore their use in broader pain conditions. For now, topical lidocaine stands out as a valuable tool in the fight against chronic localized pain.